Coronavirus, or COVID-19, is one of the biggest challenges we have faced as a society. Scientists are working around the clock to understand this virus to provide the best possible treatment. The virus is much more contagious, dangerous, and deadly than the flu, and can be contracted and spread to others before symptoms appear. We are all at risk for COVID-19, and we all play an important role in reducing that risk by following health professionals' recommendations to help stop the spread. Those who are at highest risk are anyone age 60 and over, even if they are healthy, anyone with diabetes, heart disease, or lung disease, and anyone with an immune system problem. We are still learning how people with movement disorders such as Parkinson's disease, Huntington disease, dementia with Lewy bodies, and related neurologic conditions are affected by COVID-19. Early data suggests that people with these conditions may be at higher risk of serious complications if they catch COVID-19. If you think you are showing symptoms of COVID-19, call your doctor or health clinic before making an in-person visit. During this time, it is important that you stay home. Social distancing is the thing to do. Avoid unnecessary trips outside of your home and any gatherings. You can still stay in contact with phone calls, video chats over FaceTime or Skype or emails. Wash your hands with soap and hot water for 20 seconds as frequently as possible and do not touch your face. Soap or hand sanitizer containing 65% alcohol breaks down the fat surrounding the virus and kills it, which can prevent infection. Stay hydrated. Drink lots of fluids to stay healthy. Exercise at home and practice breathing, mindfulness, and meditation. You might find these resources helpful. Have medications, groceries, and meals and other essentials delivered. Adults 60 years and older needing meals can contact Meals on Wheels or the City of Chicago for food delivery. Pharmacies can deliver your prescriptions. Try to keep a 2-week supply on hand. Turn virtually to your local senior center. Caregivers are experiencing high levels of stress during this time, but support is available. Focus energy elsewhere. Watch a new series. Read or reread a great book. Cuddle with your pets. Protect your mental health. Trained crisis workers at NAMI Chicago, the National Suicide Prevention Hotline, or Disaster Distress Helpline will listen to you, understand how your problem is affecting you, provide support, and share any resources that may be helpful. The CDC has a lot of useful information on how COVID-19 may affect anyone with a chronic medical problem. No one with COVID-19 symptoms, including fever, chills, sore throat, cough, belly pain, diarrhea, or excessive fatigue should visit a loved one, either in the home or a nursing home. Even if you or another helper are feeling great and not showing any symptoms, wear a mask covering your mouth and nose to keep your breath from traveling into the air. You can also cover your mouth and nose with cloth masks, such as a scarf or bandana. Be sure hands are washed and sanitized before entering someone's house or apartment. If you must physically touch another person, wash your hands before and after and wear a mask. Keep a 6-foot distance if possible. Respiratory droplets that carry the virus do not usually travel further. Explain to the person you are helping why you are wearing a mask and why you are keeping this distance, to protect them. As areas of the country begin to reopen, please remember that if you are at high risk, continuing to follow all of these recommendations is the best way to stay safe. As more people start to gather, they may spread the virus and cases may rise again. Talk to your healthcare team for the most up-to-date recommendations about maintaining your health and safety in your area. We would all love to look back in a few months, safely past the COVID-19 pandemic, and know that we did everything we could do to keep ourselves safe and to care for those that we love and need to keep safe. Please stay safe, stay healthy, and stay home.